I'm Carrie Rivera. I'm a respiratory therapist here at Memorial Medical Center. Respiratory therapy is a specialty in the medical field where we basically focus on airway management, anything to do with the lungs, anything to do with the airway. We assist with intubations, bronchoscopies. We place arterial lines. We draw arterial blood gases, tracheostomies. We assist with anything that has to do with the airway. That's our thing. My biggest thing that I would like to let people know about respiratory therapy, we don't just give nebulizers. There's so much more to what we do. Definitely, like I said, our interaction with the physicians, with the nurses, with the patients. It depends on what area I'm assigned to. If I'm in critical care, I will be rounding with an intensivist or a pulmonologist, going from patient to patient, doing ventilator management, anything basically that has to do with the airway, we're in charge of, aside with the physician and the nursing staff. If I'm up on, like, let's say telemetry, mostly my focus would be delivering aerosolized medications, bronchodilators, things like that. We're part of the code team. So we're the kind of the first responders in the hospital, along with a critical care nurse and a physician, as far as our code blues, so the code team, and then the rapid response team. We're part of that. So we go to all the rapid responses and all the code blues here in the hospital. Code blue is when there's no pulse, respiratory arrest, cardiac arrest. And a rapid response is actually something that where if anybody feels, whether it be the patient's family, nursing, tech, anybody feels that there's just not something right with the patient, it could be very minor to something severe, rather than waiting till it progresses into a cardiac arrest or respiratory arrest, you call a rapid response to basically get attention to that patient immediately. And the NICU is a fairly new service for Memorial Medical Center, where we just had kind of basic neonatal services, oxygen therapy, things like that. And recently we changed into a NICU, and so now we're actually having babies on ventilators, taking care of neonates on ventilators. So this is kind of a new for Memorial Medical Center, and so we've been an integral part of making that transition into a higher level care nursery. Oh, I work with an excellent team. I've worked in other facilities, and I've never worked with a team like here. The teamwork is excellent. If I'm busy doing something, I know I always have somebody to back me up, to help in critical areas. I can't say enough about our respiratory team here. I think we are the best one, for sure, here in Las Cruces. Seeing patients get better, I mean, you can't imagine how rewarding it is to see somebody come in, be put on a ventilator for respiratory failure, and then see them gradually get better, wean them off, and actually be able to have a conversation with these people, and just see them get better and go home. Sometimes they even come back, and they'll come back to visit, and they're very, very grateful, and so that's definitely the most rewarding aspect of it.